and get everyone to wash their hands and remember how important hygiene is, especially in our world today where pollution is on the rise. And thankfully the Global Hand Washing Day took place for the first time on October 15, 2008, the date chosen by the UN General Assembly in accordance with year 2008 is the International Year of Sanitation. And for more highlights on the issue, we are joined in the studio by Dr. Magdy Badran, who's a consultant as well as a professor of allergy and immunology and a fellow of the Graduate Institute for Childhood and Motherhood, Ain Shams University. That's a long title. Good morning, sir.
Doctor, some people might think that this is not that important to understand something like this, how important it is to learn how to wash our hands. I think this is something very important. First, could you tell us how far it is important to prevent our children or protect our children?
All of us agree there are a lot of diseases spreading now in this century and the last century. And if you compare the interventions you want to do to stop the progress of diseases, for example, we say we want to make some achievements, some discoveries, some inventions, we will spend a lot of money on the drugs, on the strategies to manipulate or to diagnose or to put the people inside the hospital, inpatients like that. You will find the simple, the most important intervention and the cheapest you can do is just hand wash. Very simple, very simple. It will decrease the fatalities. In the pediatric field, we have every day about 5,000 deaths just from lack of hand washing. If you teach the people how to hand nicely the things they are doing, how to take care of their hands, how to do proper hygiene of the hands, you can stop the deaths of 1 million child every day, every year. A child can be saved simply by teaching the mother how to take care of her hands and his hands. The fatalities of diarrhea each year is 2 million. 50% can be reduced by just hand washing. The respiratory infections can be decreased 25%, and the fatalities can be decreased 25%. The food poisoning, 100 million cases every year, you can decrease also by hand washing. The pneumonia can be decreased to half by just hand washing, and to spread this from one person to another. Not only you and your colleagues and your family and everyone around you has to practice and focus on how to wash hands properly.
Can you transmit diseases by handling food, and what are those diseases? And
a lot, as an example, hepatitis A virus spread due this, and a lot of more than 250 diseases can be spread by just improper hand hygiene. And
what are the prominent ones in Egypt?
For example, here we have hepatitis A virus spreading too much in children, and all the foodborne illnesses like salmonella, typhoid, food poisoning, a lot of gastroenteritis common in children due to lack of this hand washing, because the microbes will be attached to the skin or the fat on the skin. If you just remove it and remove this layer, you will get rid of it.
Doctor, talking about washing our hands, well, most of us, we wash our hands often, okay, right? But the point is there a special technique, or just washing my hands like this every now and then, this is going to be enough?
No, the technique is different. You know, all the people wash their hands like that, and quickly, but very quickly, and sometimes say my hands are clean and not washed. No, you have to wash.
And sometimes they use wipes.
If you are in the desert, you have no facilities, maybe you can use any alcohol-based sanitizer, hand sanitizer. If, for example, if you want to now to wash our hands, I'm thinking my hands are dirty. I touched a surface in a hospital. I want to shake hands with someone and I have a common cold. I am afraid about my hand. I touched any surface, TV, remote like that, or a key, doorknob like that. You have to turn on the water, tap water, okay, then you wet your hand, especially warm water if available better, then you, okay, normal, then you scrub your hands nicely with the liquid soap better, in between the fingers, around the nail buds, under the nails, remove the watch and these rings and that, the back and the front, and scrub about 20 seconds. You say to make this time near to you, just to you sing happy birthday to you twice, you know, about 20 seconds, then After this, after washing and this lather, out of lather, you have to do this. You wash with normal water. Then don't dry it in a towel or the clothes or the air.
Towels sometimes have microbes themselves.
Millions.
So as if I did nothing.
Yes, and don't dry it in the normal machines now for hot air in some shops and this
dryers or something.
Hotels and this. No. It is not healthy, because these hot dryers will take the microbes from area to the shoulder, to the wall, to the air, in the bathroom, like that. So you have to dry it in special tissue and disposable, paper tissue, disposable, and don't throw it. Use it again to turn off the tap and to open the door. Because if you enter the bathroom, the number of the microbes in your hand usually about 5 million to 10 millions. But if you wash your hands, then you touch the tap again after you finish, and you are going outside, you touch the door, no, okay, you have about 20 to 35 millions. So the way to use the tissue again to stop the water and to throw it in a clean basket like this.
Can this process be reduced to a sort of 5-second thing by just merely using a hand sanitizer?
No, because usually if you are washing continuously, maybe, but when your hands are dirty, when you have a lot of microbes, no, you must use the water this way.
So you mean that I can just catch some microbes from the towels as well?
Of course.
After washing my hands?
So
how can we solve this?
The air of the bathroom, of course, all of us agree that.
We are talking at home, not outside.
At home, yes, at home, in your home. Your home is clean, okay, I agree. But inside your home, there are a lot of secret places for microbes inside the bathroom. WC, the toothbrush, it is inside. The toilet, the air, the walls.
What about the toothbrush?
The same. The toothbrush, usually, because a lot of microbes in the air of the WC, and there are toothbrushes, all these microbes usually will settle down on the toothbrushes. So it is not the ideal place to put it inside.
I'm going to hold on, but the toothbrush, I'm going to put it in my mouth. Okay. So I'm going to swallow all the microbes.
So for all these years.
So the ideal place for the toothbrush, not in WC. At all. You put it in any airy place outside.
So away from the hands. Now I have another filter.
Away from the hands, away from the air. We agree now, contamination inside the air of WC. Of course, everyone will go outside, put about his, like this, secretion stool and this. You agree have to 20% of the weight of anything you put in this WC will be microbes. By weight. 20, and a lot of microbes will go up according to the dentistry. Some will go up again.
I'm never going to the bathroom again. I'm worried.
Some will go up. Some microbes will settle in the air. Some will go on the floor. Some will go on the walls. Anything. So the ideal way that's to do what I am saying now, and take care that not only that, especially in the handle or the knobs. You are touching every minute, you and all the people in the house, visitor like that, will have a lot of microbes. No one sterilizes the nose, no one sterilizes the tap. No one. So you have to know that a lot of microbes inside your house.
Well, Dr. Magdy, in the midst of our political transition and everything that is happening on the Egyptian street, if you go to the average Egyptian and you tell him this is Global Hand Washing Day, he's not going to respond very positively.
So when we teach, the more you make campaigns, the more you make lecture like this, the more you have a program like this, step by step, day by day, the propaganda is helping us, and the people will become aware of the value of hand washing. And if your hands are clean, sure, your clothes will be clean, your books are clean, your house will be clean, and your street will be clean, your office will be clean, and I think you have also, this will spread to your behavior. You must be, the clean hands will not steal, will not kill, will not cheat, will not lie. I think you have to do this, and to spread and to teach each one. Teach your friends, teach your children, teach your brother, teach your family how to wash the hands, and teach the normal people around you who cannot hear you or cannot, you see their nails are dirty, their hands they have a lot of diseases.